Welcome back to Ask Allison. Here is today's question. I'm wondering what your procedure is for administering risk assessments in the first session. Do you do a formal assessment for all new clients? Is it verbal or part of your intake questionnaire? So first, I'd like to thank Therapy Notes for sponsoring us. Always check with your board. Also, I'm a clinical supervisor, but I'm not your clinical supervisor. So keep that in mind as I tell you what I do. So I have questions in my intake forms that cover harm to self and others. I follow up with any affirmative information they put in there. And once we've been talking for a little while in the intake and it's feeling like we have some solid rapport, that's when I'll start by asking them if they've ever had suicidal ideation in the past, or if they've ever intentionally hurt themselves in the past. Oftentimes they're not totally honest on their intake forms because it feels really vulnerable to write that down, even if it is just like circling a yes. So I wait until we have a little bit of rapport to double check if they say, no, they've never experienced that. So it's often easier to start out talking about any past experiences like that. And we talk through the ideation or the attempts in the past and how dire it got. And I do a lot of validation about how hard it must have been, how strong or brave they are for being able to like get out of a situation in which that felt like the right choice or a choice they were really considering making. And then I say something like, does the same thing that helped you then help now when that pops up in your mind or when you're feeling that way? It allows for the expectation that might be a part of their current experience rather than having to like keep it relegated to the past. And because I've already shown them that those thoughts and feelings don't scare me, and that I'm not judging them for having felt those in the past, they feel safer to be honest with me, talking about the present. So most of the time they'll say like, oh, well, it hasn't happened since then, or it hasn't happened in a while. Or I have passing thoughts sometimes, but it's not bad enough to worry about. They don't concern me. But every once in a while, it does open a door of openness and honesty about some more high risk things that they might not have been open and honest with me otherwise. If you work with a higher risk population than I do, even if you don't, it is so important, y'all, for us to get comfortable talking about suicide, self-harm, harm to others. Our mindset around it as the clinician in the room makes a huge difference in how we assess and how safe our clients feel being 100% honest with us. Talking through your own fears about working with suicidal clients, that's a really great fodder for supervision or clinical consultation. For us to be able to do that part of our job effectively, we can't be so afraid of it. We're afraid to ask the question, or we're afraid to hear a true, real answer. So I think we all could probably use a lot more training around suicide. It feels like so scary and so awful. And there's also the liability piece that lands on top of the scary and awful. That I think training sometimes can really help, as well as ongoing conversations with colleagues or supervisor or clinical consultant. So I hope that helps. If anyone needs more clients in their practice, or you're full and you're miserable, I have a free training that can help you get your practice where you want it. That's over at www.abundanceparty.com/Phil, F-I-L-L. I'll link to that. If you have questions for Ask Allison, please DM me over on Instagram, where I'm abundance_practice_building. I will talk with y'all later.